I go to Kaiser for my healthcare. I live in Aurora. I know many of the people that are providing that care live and work in Aurora as well. And I know that you need and deserve better wages, and an employer that acknowledges the great contributions that you make to our community and to ensuring that all of the people in Colorado get good quality care. It's really you that's making that happen, not the corporation.
Medical workers and healthcare workers are my family. We care about them, we take care of them. They take care of us. In some of our most trying times, they're there for us. It's important that we be there for them.
You all give so much of your heart and your time and your energy to care for everyone else in this community. And it's only right that your employer takes care of you.
We know who's doing the work. At the end of the day, if you aren't there getting the work done, we don't have health care.
The work that y'all do is so critically important in the provision of care. And so I'm just here to say, one, thank you for the work that y'all do on the daily.
I have never had an experience at Kaiser where people are anything but respectful, caring, and supportive of my family. That being said, I do sometimes see that people are having long wait times or appear to be doing a lot more than makes sense for one person to be doing.
In my work in the legislature, I know intimately how important it is for us to be able to retain and recruit excellent healthcare workers like yourselves.
Across the board, there are worker shortages, and it puts such strains on the system, and our SEIU workers are the absolute backbone of the healthcare systems.
Like any company, you're only as good as the people that do the frontline work. I think some of that's gotten lost, and you need to respect your workers because they're what make you who you are.
You know, if you want to attract the best Kaiser, if you want the best employees that you can attract and retain to deliver the highest quality, sit in good faith at the table and work with your union.
I know that across the country, we're dealing with staffing shortages. If you pay higher wages, you're going to be able to hire more people. Not only is it the right thing to do, but it's clearly the right thing to do for your business model.
My message to Kaiser is that your business model doesn't work without healthcare workers. Your profits don't happen without healthcare workers. So it's time to start sharing in those profits with the people who make your jobs happen.
There's no business without your healthcare workers. It's just not possible. So they need to be paid a livable wage. They need to be compensated for what they do.
It's stressful when people cannot pay their rent, when people cannot feed their children, and yet we're calling them to the hospital, we're calling them to the clinic to take care of other people when they cannot take care of themselves. So it's very important that we support them. We provide them the basic necessities that they need, such as a livable wage, because a sick person cannot take care of another sick person.
And my message to management is do right by the people who make you successful. You would be nothing without these folks.
It is the workers who have been able to weather the storm to continue to provide care in these most critical of times. And so for you as management, I ask you, pay these workers what they're worth. Come back to the negotiating table and settle a fair contract. And I urge Kaiser to be fair and in good conscience, get to the bargaining table. Treat your workers right.
Your employees understand that we support you in your negotiations. We're always behind the working people. You guys are the ones that make things happen. You are the ones that give us all the opportunities we can have. And here with SEIU, backing you and supporting you, hopefully we can come to a resolution that gets you taken care of.
And know that there are so many of us, myself included, who are standing in solidarity with you and will be there shoulder to shoulder at the next actions throughout this process, because you're not alone. For the 3,000 Colorado Kaiser members, for the 85,000 Kaiser workers nationwide, we know that you all can do this. And so we're asking you, continue to treat these workers with the dignity and respect and the care that they deserve.